Patients Know Best is a patient-controlled medical record. That means we get all your data from everywhere that has information back to your hospital, your GP, your social care. You own that data. You can add to it your own symptoms, your devices, and so on. And you decide who gets access, and also you begin to understand your health. So that model started from a few departments in a few hospitals 10 years ago. Now we have 4 million people's records. We have contracts covering 12% of the UK, and the system is used in 10 different countries for research beyond the UK. So there are many benefits from the patient having all the data and interacting with their circle of care. So one example of that is in Bristol. They're the local referral centre for anyone with severe trauma, head injury, car accident, that kind of thing. And many of the patients, they come in often unconscious, and they often leave not knowing what happened to them. Then within 30 days, 71% of them turn up in GP surgery and say, I don't know what to do about my head injury. And the GP says, I didn't know you had a head injury. What they did in Bristol is become the national exemplar, which is before discharge, they give them a Patients Know Best record and a care plan saying, this is what happened to you, this is what we did to you, this is what you need to do at home, and if you're stuck, this is how you contact us. And just that simple intervention, the patients went from 71% to 51% needing to see a GP. And of course, the meeting with the GP is much better. They can say, I'm stuck at this stage. And the patients get full support with their carers and the hospital via the messaging and the care planning. In terms of spreading the system, in the beginning, we just targeted clinicians who are dealing with difficult problems, patients with complex conditions across multiple specialists. And we just had to prove it across different environments. 2015 was our big break when North West London said you have enough examples, small examples, but lots of them, that we can do this for 2.3 million people. That was the first time in the world that a health economy had said all the data will be held by the patients. And then last year we cracked scaling this up in that we automated every patient getting the system, and we automated tracking the fact that every time the patient used the system, they saved the NHS cash. And so we shared in the cash that was the NHS had saved, and that transformed this from a future luxury to an immediate essential for the NHS to look after patients. The revenue model we have is around if you register a patient and they see the data quickly enough for you to avoid posting it, you basically avoid the postage and you share the postage with PKB. So after paying Patients Know Best, it's share. Every patient who is registered is worth £1 per year per hospital. So if you can imagine the hundreds of thousands of patients that a hospital looks after, or the millions of pounds they spend, that's basically every patient they convince to register saves them £1. And our hospitals are now, when they go live, they register tens of thousands of patients, so they start generating cash from that. The real benefit is not from the postage for the appointment, it's the £100 when you avoid the appointment, or £1,000 when you prevent the A&E visit. But for the finance director, that ties a cash releasing benefit from that then sets up a clinical transformation program. I found the Innovation Leadership Exchange program really fascinating today. I mean, the countries that are included are very highly technologically advanced, but they're different healthcare systems, they've got different pasts, so it's really interesting to learn what people have done in different ecosystems. And then because they're small countries, they're all export driven, so they're all about taking innovation and taking it globally rather than just being in a local market. Also, I didn't realise until I came on the day, but pretty much every country that's invited has the same self-deprecation sense of humour, so it's a race to the bottom and everyone being very humble today. So it's been really nice spending the time with everyone.